Welcome back. Now, for many people living with psychosocial disability, access to support and health systems to effectively treat their conditions remains out of reach, and many are often also misunderstood. Now, as we commemorate Mental Illness Awareness Month and Psychosocial Disability Awareness Month, this morning we take a closer look at psychosocial disability, a condition described as a disability that may arise from mental health conditions or illnesses such as bipolar, schizophrenia, or post-traumatic stress disorder, impacting on individuals' quality of life. And to help us discuss this further, we're joined virtually now by Adjunct Professor Lesley Robertson from Wits Department of Psychiatry, working in the public health sector as Head of Community Psychiatry in the Sedibeng District of Gauteng. Prof, thanks so much for your time and welcome to Morning Live.
Thank you very much for having me. Thanks very much.
This is very interesting. You know, as we commemorate Mental Illness Awareness Month, it's also Psychosocial Disability Awareness Month. But how do these two differ?
All right, so mental illness is the illness that the person suffers from. And we have to remember that the definition of illness is a little bit different to when we classify disorders and diseases. Illness is actually your subjective lack of well-being, your subjective lack of health, okay? But illness itself tends to be, it may be acute or it may be chronic, maybe short-lasting or it may be persistent and enduring. Now, when you have disability, that is the interaction or the result from the interaction between the effects of the illness on your mental or physical functioning and the environment that you live in. So disability can be lessened by the treatment of the illness, if the illness can return functioning to a healthy, completely healthy and normal, what we consider normal in society. Or it can be lessened by the adaptation of society to that person's functional impairment. So we think of somebody in a wheelchair who's had an illness, traumatic injury to the spinal cord, they're now quadriplegic, so they are now committed to a wheelchair. We mitigate the disability by making sure we've got ramps so that they've got access to buildings, by helping them with the wheelchair, making sure entrances are wide enough for the wheelchair, making sure we've got toilets, public toilets that can accommodate a wheelchair. So we reduce their disability through societal measures to help that person to function in society. Because what's happened is the medical and surgical sciences have reached their capacity. We can't return the individual's functioning completely to them as the individual. So we can't now say, oh, well, now you can get up and walk. We don't have that kind of power. So in psychosocial disability, the disability arises from the type of impairment that people with mental health conditions suffer from, and the way that environment or society accommodates that impairment. So the impairment that people with mental health conditions suffer from is it's usually to do with our frontal lobe and sometimes with our emotional centers, the way we access our memories. But essentially, we've got what we call executive dysfunction. So that's planning, problem solving, working memory, paying attention, concentrating. And then it may affect the way our social cognition, the way we interact with others, how we read behavioral cues from others, how we read their facial expressions, how we interpret them, and then how we respond to them. So you can see that we've had a lot of education in society now about autism spectrum disorders, which is quite a very quite a well-defined neurodevelopmental disorder, which affects the person's ability to interpret social cues and to respond to them appropriately. And because of that, their social functioning becomes impaired. And the only way to accommodate that is for society to adapt to that person's way of doing things. We can't treat them out of autism spectrum disorder. So we have to be patient, kind. We have to accept and understand when people are different. So this is the neurodiverse movement that we're seeing. But you have a lot of various different disabilities with mental health conditions, and they all affect cognition when they're disabled. So it's severe conditions, like you say, schizophrenia, bipolar disorder, but severe anxiety, severe depression, severe post-traumatic stress disorder, and as I say, the neurodevelopmental conditions, autism spectrum disorder, attention deficit hyperactivity disorder, and then obviously the neurocognitive conditions, which we widely know as dementias, create tremendous disabilities. And then we have the intellectual disabilities, which are classified as neurodevelopmental conditions. No, there's no medicine to change that. There's no rehabilitation to remove somebody's genetic or environmental impact on the way the brain functions. We can mitigate it through occupational therapy, through psychotherapy, but we can't change the way God has made that person. What we need is society to understand. So we have signed and ratified the Convention for the Rights of Persons with Disabilities, and that places a huge emphasis on society's accommodation of people with these disabilities.
Prof, I'll tell you what,
yeah.
and I'm loath to interject, but I must. And I think when we started out on this, perhaps, we also underestimated from our side how complex this is. And just listening to you and trying to explain what it is that we are dealing with, the scope of it, we haven't even touched on anything else. So what I'm going to do is I'm going to ask you to please, if possible, if we can revisit this maybe in the same slot next week, so that we can expand upon exactly how society then deals with what we have identified, because this one slot is not enough for this. But thank you so much, all the same, for your time.
I would love to join you again to discuss it.
Thank you so much, Prof, because I think it is important. Adjunct Professor Lesley Robertson from the Wits Department of Psychiatry, who works in the public healthcare sector as Head of Community Psychiatry in the Sedibeng District of Gauteng, talking to us about the link between mental illness and psychosocial disability and the treatment and medical care interventions. So interesting what Professor Robertson is saying in terms of when we cannot treat people out of certain illnesses, how do we deal with it at the societal level?